Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I have a special guest with me here. It's Dr. Ankita Shah. Welcome, Dr. Ankita. It's wonderful
Hi,
to have you here.
Kristen. Hi, Kristen. It's my pleasure being presenting to so many people via Gold, and it's going to be an exciting day for all of us. I'm happy that I'm going to be sharing some information with everyone.
That's
And
fantastic. Yes, you are part of our Gold Tongue Tie Online Symposium of 2022. We have 5 presentations, 2 days, so 10 presentations altogether, 5 presentations on each day. And I think you are starting our Tongue Tie Symposium off, right? And I know it's going to be fantastic. We're going to speak about the presentation in a minute. But first, let us know a little bit about yourself. You are a dentist by trade. Tell us how all that evolved, that you
Mhm.
are now also an expert in tongue tie and a specialist in that. So tell us a little bit about your background.
So I'm a pediatric dentist, and there was a time when there was a lot spoken in pediatric dentistry about, muscle influencing the teeth position. So I was a little stumbled by this, like, what is this? There's something not heard of, like how are muscles influencing teeth position, and why are they talking that don't do braces, just do muscle function? I was a little questionable what's going on here. And I digged into my research, learning. There I came across myofunctional therapy. As I came across myofunctional therapy, there came my attention towards tongue ties. And
Ah,
that's how the whole role of tongue ties started to display in my education and understanding. And then I started observing patients at my clinics, and I was like, this is true. Every couple of, I would say, 1 in 5 to 7 patients that I see would have those signs and symptoms. Then I stumble upon the role of tongue ties not only influencing breastfeeding in infants, but the age group that I treat was from 1 to 18.
mm,
And I started seeing those signs and symptoms in kids, and it was affecting their breathing, sleep patterns, their eating patterns, speech, and a lot more, which was important for the entire growth and development. So that was one of the key backs to take back from there. Then a couple of adults also approached me, and I was like, I'm seeing these signs and symptoms in them also. What's going on over here? And that's when I realized that, it's high time that, we see this curve of how it's affecting right from infancy to childhood to adults, and wherever we're very sure about the role of that tongue at infancy and we can see that it's interfering, best to get done with it at that age group than have the person suffer through that whole timeline.
gosh.
So
Yeah.
yeah, that's how I stumbled
What
upon
a
it.
fascinating journey you took there. Probably when you started out looking into that, you had no idea, right? How
Absolutely no
far it
idea.
would go, and what you would all learn and see there, and also in your practice. That's fascinating. And you're right, yes. And the little ones, you sooner we see this, the sooner we can diagnose, the better, and we can treat it and then avoid long-term effects like later in life. And this
It
is
is.
interesting to me because in the beginning we focused on, okay, so the baby needs to be treated so the baby can, breast or chest
Best.
feed
Right.
successfully. But then now looking at, okay, what does it also mean for the older child,
Mhm.
the toddler, the older child, and then up to adult age is fascinating to me, because at one point there was this, oh, once they're, the body will adapt, and
Mhm.
then we don't have to, as long as they can speak fine, everything is good. We don't have to
Mhm.
be so concerned about this, and
Mhm.
and why create problems when they're not. But it's interesting. I feel like with tongue tie, it's one of those things we just barely know anything, right? We know so
It
much
is.
more than few years ago, but it feels
It
like,
is.
wow,
It is.
we're scratching the surface and there's still so much more to come. And that
There's like every time you want to know, there is so much of new development through it. Obviously, the complete way of we looking at tongue ties from the way it was diagnosed years back to today, the functionality of the
yes,
tongue to the whole fascial system involved, it's just stumbling, it's astonishing. And when you see those effects live in front of you, oh my God, the posture change. Oh my God, this change. How did this happen?
it,
And it's just fascinating.
it's absolutely absolutely fascinating because I had a little sneak peek earlier on into your presentation, of course,
Yes.
and I know
Yeah.
you will show some exciting videos, and
Yeah.
I'm really looking forward to that because it shows really the before and after, not only in a baby but also an older child. I guess we
It
get to
does.
see there.
Yeah.
And so now about your presentation, which is titled "The Impact of Tethered
Mm-hmm.
Oral Tissues on the Fascial System." And let me ask you this about the fascia. It feels
Mm-hmm.
to me, I mean, obviously this is also one of those new, although fascia is not new, but
Mm-hmm.
topics that we recently in recent years learn
Mm-hmm.
about. I can
Mm-hmm.
remember, being trained in my medical background in my field there. Nobody really talked about fascia, right? I mean,
Mm-hmm.
this is like something was mentioned, but how is this? What does that even mean? Does it surprise you that because some people even tell me, oh, is this really, is this one of those fads again? What are we doing here? Do we really need to
Mm-hmm.
look at everything is not the fascia? What's going on here? So tell me a little bit about the fascial system. I know we don't have much time, but what have
Yeah.
you learned over, what have you
Yeah.
seen that really you think is
Yeah.
important?
So it's been so many years, like as a dentist, even we've done dissections and everything, but I don't remember any single person coming up
Right,
to me and telling me that, oh, this is the fascial tissue, or this is what it
right.
is, or, it's an important tissue. All we are taught is muscles, nerves, blood
Muscles.
vessels, and that's it. But no one really spoke about this. And the first time I got exposed to it was only through the tongue ties. And then when I started meeting some physiotherapists and body workers, that is when they told me that it's a system that we've been exposed to. We've also not paid too much attention to, but it is now that the whole body and the whole link of how a change in one side of the body is affecting the other side of the body is coming through to the biotensegrity of the fascia. So it's really interesting. This is like a tissue, but it's a system in itself. And we're going to explore a lot about it through the presentation of how the tongue is also going to show different forms of how it represents and how it's affecting different stages of your body through this fascial system.
That's fascinating to me. And you're right. It feels like this is something, it's been there all along. Where where has
It
it been? Why
is.
haven't we learned much
Why
more
have we
about
not
it,
been exposed to it, right?
Exactly, exactly. So, and it's fascinating to me how everything is connected, right?
It is.
And bringing this all together and seeing, okay, what can we do now? What can we
Right.
do differently now than even a few years ago? And then
Okay.
what does that mean for the future? So if I ask you this, I know maybe it's a difficult question, but what are you hoping to see for the future in this field? What is still for you, what you would like to see to be explored or looked into?
I would say in the end, what I've been observing with, all the age groups, right, from infancy to adults, in the end, it is something that's affecting the breathing. And
Mhm.
breathing is that one aspect that as dentists or as any other medical professionals, we've really not looked into it so much. So if it is the role of the tongue or if it is the full body approach, wherever we are looking at, I think we need to look at a holistic approach. I think we need to just open our eyes. Yes, I don't want everyone to just look at that, oh, tongue ties and breastfeeding and just end it there. Like there is a certain percentage of tongue ties that interfere with breastfeeding, but certain percentage of tongue ties do not show any symptoms with breastfeeding, right?
Mhm.
Absolutely goes. So where is that role of the tongue? Is it only the tongue or are there any other factors as well? So I would love that people dwell into it and look into it with like a complete holistic approach. That
Mhm.
is where I think we're going to find our missing pieces. And I wish our college and education system can get this involved because that is where we are missing. And most of our dentists don't get educated later on. And
Yeah.
if that gets involved at the root level in colleges, I think we can help millions of babies and children and adults here, right?
Yes,
It's it's,
yes.
it's
Oh,
just mind
it is a
blowing.
big issue. Yes, it's not just
It
the
is.
baby and the breastfeed. It is, and finding a holistic approach
It
sounds
is.
absolutely fabulous, and it's so needed in teaching that
It
in
is.
colleges.
It
Well,
is.
thank you so much, Dr. Ankita Shah. I'm really looking forward to your presentation, and thank you
Thank you,
so much
Kristen.
for spending time
Thank you.
with me today.
Thank you. It's my pleasure being there with you all.
And now a little information here for our viewers. If you would like to see Dr. Ankita Shah's presentation and be part of the Tongue Tie Online Symposium 2022, we have 2 full days, and you know, you can decide to watch or participate in both days or just one of them. You can find information at goldlearning.com. There you will find out about this information, about this presentation, and all the other presentations and presenters in the symposium. So I hope to see everyone at the symposium. And thank you again, Dr. Ankita Shah, and bye-bye to
Thank you,
everyone.
Kristen.
Bye.
Bye.